Welcome to This Week in Health IT News, where we look at as many stories as we can in 30 minutes or less that will impact health IT. My name is Bill Russell, healthcare CIO coach and creator of This Week in Health IT, a set of podcast videos and collaboration events dedicated to developing the next generation of health leaders. It's Tuesday News Day, and here are some of the stories we're going to talk about. Why digital healthcare lags, from Ed Marx, former CIO of the Cleveland Clinic. Standardizing metrics for EHR log data, interesting work that's being done by the AMA. VA set to open fully 5G-enabled hospital in California. I have no idea what that means, but we'll take a look at it. Advent Health switches from Cerner EHR to Epic. Interesting. Providence and Cedars break ground on $500 million expansion. Bon Secours champions best idea wins through merger. A really good article from Becker's. And ONC Don Rucker calls out hospital leaders who signed Epic's opposition letter. He is a lot of fun. We had him on the show, a lot of fun to listen to, a lot of fun to read about. So we will take a look at that story. This episode is sponsored by Health Lyrics. I coach healthcare leaders on all things health IT. Coaching was instrumental in my success and is the focus of my work at Health Lyrics. I've coached CEOs of health systems, CIOs, CTOs, startups as well. If you want to elevate your game in 2020, visit healthlyrics.com to schedule your free consultation. Quick comment about the mission of the show. I got a couple of emails this week, which was interesting, asking me about, what's the show and what's it about. It's really quite simple. Healthcare suffers because health IT is lagging. We amplify great thinking to propel healthcare forward. That's it. And, that's what we're trying to do with the show. That's what we're trying to do by on Tuesdays, we look at the news to keep people current. And on Fridays, we interview industry influencers so that we can uncover the best thinking within the industry and get it out there to as many people as we possibly can. So if you want to help the show, best way to do it, share it with a peer, get it out there. So today, it may sound like I'm in a bad mood. I've read a lot of things that I'm sort of scratching my head on, but I try to be constructive on the show, try to present solutions, so you can hold me accountable to that. All right, let's go. 10 stories under 30 minutes. Why digital healthcare lags. This is Ed Marx, former CIO of the Cleveland Clinic and frequent guest on the show. Ed wrote this on LinkedIn, so if you want to find this article, go to LinkedIn and find his profile and pull it up. So he gives 10 reasons why digital healthcare lags, and I love it. It's really good thinking. So IT leadership, he says, gulp, this is me, my circle, my friends. We unintentionally became inbred. We believed that to be effective, our workforce had to possess healthcare experience. We are special, unique, balderdash. We stifled innovation that comes from hiring from outside ourselves to include progressive industries. We insisted everyone have 10 years of this or that in healthcare. Worse, we specified technical degrees. The best teams have a mix of degrees and experience in and outside of healthcare. We can fix this. All right, so he goes on, 10 more of these. I'm going to touch on some of them. I'm not going to read all of them. People development. We stopped growing our teams once they left orientation. Great point. Finance, he talks about old practices and how we have this return on investment metric and these governance structures, but digital changes things. It's marked by agility, velocity, return on experience, but we still employ the old methods. Supply chain, he talks about operations. We desire digital technology adoption such as virtual care, but struggle to evolve because of tradition and cannibalization fears. There's a fear of use cases for emergency departments to adopt virtual care, but resist because of potential revenue loss or ED patient volume decreases. This is all true. Clinics, digital is synonymous with transparency, simplicity, service, and automation. Bottom line, the experience. USAA, Marriott, American Airlines know more about me and my family than my healthcare system. It is easy to communicate through multiple channels, easy to make appointments, easy to interact, easy to share information. Easy. We can fix this. He talks about fear of failure. People have said, fail fast. This is what they do. And then healthcare says, hey, we can't fail fast. We're talking about people's lives. And he talks about failing safe, utilizing the technology in areas where it's not going to impact patient care, but you can see how it impacts the overall environment and then slowly adopt it in other areas. But failing safe, but still failing fast. We have to be able to make mistakes within healthcare. He talks about the Lone Ranger mentality. And then the last one is Chiefs. I like this one, so I will read this one. So each year we fall further behind digital. CEOs get increasingly frustrated I've seen that. I've talked to CEOs who say that, appropriately so. We hire more chiefs. We don't address culture. Too difficult, too controversial, too confrontational. Easier to hire more chiefs. We see rise of chief digital officers, experience officers, innovation officers, transformation officers, digital, what did I do wrong here? Data officers, knowledge officers, business development officers. New chiefs plus existing chiefs make a bunch of chiefs. You can see where this is going. Inadvertently, gridlock multiplies. Smart ideas and people, but execution paralysis given competing agendas, silos, and duplicative teams. Costs go up, frustration increases, gaps widen. We can fix this. As you know, I try to end each story with a so what, and the so what on this is I have nothing to add other than amen. This is a great, really well read, written article. LinkedIn, hit Ed's profile. You can download it, take a look at it. All right, next article. Standardizing metrics for EHR log data could help combat clinician burnout. Healthcare IT News. I pulled two things from the bottom of the article up just to highlight this. So a Mayo Clinic study from November 2019 linked EHR usability with clinician burnout, with the usability of current EHR systems receiving a grade of F by physician users when evaluated using a standardized metric of technology usability. All right, so Mayo Clinic study found F in usability. A July 2019 study in Health Affairs, meanwhile, found that EHR messaging improvements could be key to reducing physician burnout and concluded health systems should reconsider whether system-generated automatic messages are the best way to ensure quality of care. All right, so you have these two studies. Now I'm going to go into the articles. So the research was led by Dr. Christine Sinsky, Sinsky, Vice President of Professional Satisfaction at the AMA and an expert on physician burnout. The report notes that the use of EHR log data to further understand the clinical environment in a nascent science, and Sinsky proposed standardized metric is comprised of 7 core measures for auditing EHR log data, which reflect multiple dimensions of practice efficiency. Those encompass total EHR time, work outside of work, time on documentation, time on prescriptions, inbox time, teamwork for orders, and an aspirational measure for the amount of undivided attention patients receive from their physician during an encounter. So that's the undivided attention metric. This is a good set of metrics. My so what on this is good work, good approach. I'd love to see us to really tackle this problem of clinician burnout. As you heard in last week's show, I experienced some of this with the poor nurse practitioner sitting in front of the EHR and not leaving the side of the EHR. If I had to say, which one she, cared for more, she cared more for the computer than she cared for the patient. Now, the good news is there was a lot of nurses coming in and out. That was sort of her prescribed role, was to sit in front of that computer, and they orchestrated it in that way. So here's the thing I want to make sure that we don't do, and don't treat this as a potential leading metric. It might be a lagging metric. This could be the result. As we've talked to other people in the industry about clinician burnout, and it could be a result of changing business practices, compensation practices, reimbursement, bad policies, business culture, as well as bad software and bad implementation. But it's really there's a lot of things. If we wanted to create a clinician burnout metric, it would have to encompass more than just these things, although this is a great set of metrics to start with. And I'm sure Dr. Sinsky is going to head in that direction once they really tackle this, the burden of the technology on the practice of medicine. So I just want to make sure we see the whole picture on this and keep our eye on the greater problem that is out there. All right, next story. VA set to open fully 5G enabled hospital in California. Healthcare IT News. So here's what it has to say. The advanced cellular networking capabilities will enable the delivery of telesurgery services to veterans, allowing physicians to consult during surgery, even across the country, said Secretary Robert Wilkie. Along with decreased wait times for appointments and better overall care, the Secretary pointed several other programs designed to provide better veteran care, including a pilot program to develop exoskeletons that stimulate the spinal cord. Instead of the exoskeleton moving the patient around, the patient can increasingly control the exoskeleton as their own muscles are reactivated, said Volke. With further research at the VA, we are hoping to turn exoskeleton from a mobility device into something that trains injured people to walk again under their own power. Not to call anyone out, but this story is probably goofily written. It's a goofily written article. Because if I looked at these two things, this article is really about the exoskeletons. Wow. Awesome. I mean, this is awesome stuff. It's the stuff that the VA should be leading on, given the mix of their patients and the things that they're dealing with. It's exciting stuff. You have neural connectivity to these exoskeletons. You have the ability for them to start to control, to regain movement. That's exciting stuff. Now, maybe it doesn't get as many clicks as 5G today, and maybe that's why it was highlighted. The 5G stuff, quite frankly, you wouldn't make a hospital 5G enabled. I'm not even sure what that means. You're still putting in fiber optic. You're still putting in Cat 6e. 5G would not be able to run the entire hospital. So you have this underlying network that's still in place. All the things that are talked about in this article in terms of being able to do consults and telesurgery across the country, even across the world, have already been demonstrated. There's a surgery that was done between the U.S. and India where they were in. I mean, we could do this across fiber optic. We could do this across Cat 6e, and actually, it's preferred to do it that way. It's much more reliable. So there's really nothing in terms of how that, it's a bad title for the article. VA set to open fully 5G enabled hospital. I don't think there is a fully 5G enabled hospital metric at this point, and the exoskeleton stuff is really awesome. And I would love to hear more about that and love to see the VA really pump a lot of money, research, time, report, give us, information. How is this progressing, and how are we going to see this come out into the commercial hospitals as well? So exciting work. I like what the VA is doing. I like that Secretary Wilkie is really pushing the envelope there in terms of advancing the VA through technology. So exciting work. All right, Advent Health switches from Cerner EHR to Epic. This is I got this from Becker's. This was reported in a lot of places, as you would imagine. I really like the way Becker's writes their stories. This is a bullet point format. It helps me to do my show. But it's also, it's how we operate. The bullet points are really nice. The Epic rollout will include more than 1,200 Advent Health care sites, about 37 hospitals. The health system initially implemented a Cerner system in 2002 when it was still known as Adventist Health System. Advent Health completed its rebrand in January 2019. Advent Health will implement Epic's EHR software as well as its revenue cycle system to operate on a single integrated platform. Here's their statement. Advent Health is making a multi-million-dollar investment in the transition to a new enterprise-wide platform, and it is an investment that we see as necessary and essential in keeping our promise to our patients and caregivers. In light of that, a significant portion of that investment is focused on ensuring that our entire system is properly trained on the new platform, helping to ensure a safe and secure and smooth transition. All right, just in the interest of time, you've read 100 of these articles. You know how it sort of goes. The so what on this? My take is the best EHR is the one that you're on. I maintain that this is the case unless there are extenuating circumstances. 37 hospitals, it's going to take $1 billion or more to complete. This is going to eat up a bunch of time and focus for the health system and the people involved in it. When they complete, they're going to be where the rest of the industry was 5 years ago. They're going to be completing their EHR implementation and starting their optimization process. There could be cultural reasons. I will admit there could be cultural reasons to do this. There could be operational reasons to do this. There could even be clinical reasons to do this. But I doubt you can convince me that any of these couldn't be overcome with far less than $1 billion in 5 years of time. That plus the fact that the market is moving. There's new entrants, there's new digital solutions, there's new requirements. Even the other thing I would consider is Cerner's partnership with AWS may propel them ahead of Epic in the next 5 years. Won't this seem silly if that is the case? I'm not a fan of switching EHRs unless the case is really compelling. Solve the right problems. Stop switching EHRs. That's what I maintain to be the case. Again, I am more than happy to discuss that with anyone. I'm sure there could be valid reasons for doing this. I just can't imagine the amount of time and the amount of money that's going to be spent that it makes sense. Plus, I really do think Cerner's AWS implementation, I think their new leadership, I think they had lost their way, and that's one of the reasons that this switch is probably happening, but I think they're heading in the right direction. All right, next story. Providers must invest in consumer technologies or risk irrelevance. Healthcare IT news. Let me sum this up. This is a article written, really an interview with Aaron Martin from Providence, and I can sum up this article in 3 sentences. Healthcare is behind. Digital engagement is necessary, and if you can't get there yourself, you should partner with somebody. That's essentially what this says. This article could have been written 8 years ago, 6 years ago, 4 years ago, 2 years ago. I could republish it in 2 years without changing a word, and it would be true. So here's my take. My take is know what you're reading. Providence is a vendor. They're not the only one, but Providence is a vendor. There are a bunch of health systems that have decided that they are going to be in the business of selling things to other health systems. So just know what you're reading. Aaron is smart, and I appreciate a lot of what he says. And as I said, there's nothing really new in this article. The only thing that's new is that Providence has a new digital engagement tool that they are taking to market. They also have several other point solutions that they're investors in. They may be good tools. They may be great tools. My only point is to know what you are reading. This is a pitch from a vendor. There's another story out there with some good thinking in it as well, but it is marketing. Know what you're reading. Take the good ideas, evaluate the tools for what they are. So another Providence story. So Providence Cedars-Sinai break ground on $542 million expansion at jointly owned hospital. Providence and Cedars broke ground this week on an expansion project at their jointly owned hospital in Los Angeles, according to San Fernando Valley Business Journal. The expansion at the newly named Providence Cedars-Sinai Tarzana Medical Center, that's a mouthful, is expected to cost $542 million and is slated to be completed in 2023. The expansion includes building a 6-story, 223,000 square foot patient tower, expanding the medical center's emergency department and adding space for more outpatient services. The project is a joint venture between Renton, Washington-based Providence, and Los Angeles-based Cedars-Sinai. The two organizations signed a co-ownership deal for Providence Tarzana early last year. Providence will retain controlling interest in the medical center. So what? Actually, to be honest with you, I don't know what to make of this. I think we're going to see more of it, but it's kind of perplexing to me. Cedars has the brand in LA. Providence has bought into the market. I guess they call this co-opetition is what we've heard it called. Cedars had the money to do this themselves. It's just a curious thing. But let's talk about IT for a minute on this. If this becomes the norm, I have a couple questions. How much will IT be a consideration, or will IT be required to adapt to these kind of models? When someone checks into this hospital, are they a Cedars patient or are they a Providence patient? Who owns the record? Who controls the record? Can one health system sell access to the record to pharma without the other one knowing? When they select a PACS system, will it interoperate with Cedars' platform or will it interoperate with Providence's platform? These are interesting deals. I'm more curious what you think of this deal and what it will require of health IT moving forward. I think it's an interesting question. I think we will see more of them, and I think there's a lot of complexity to this, so it'll be interesting to see. Next article, Bon Secours Mercy Health CIO champions best idea wins throughout merger. And when Marriottsville, Maryland-based Bon Secours Health System and Cincinnati-based Mercy Health finalized their merger in September 2018, the philosophy was never for one system to take over the other. Rather, leadership, including CIO of the combined Bon Secours Mercy Health, Lacey Williams Carlson, worked to merge the best practices of each system. This is Becker's article as well, by the way. She followed the model set by CEO John Starcher of moving with alacrity and zeal. Love that. That's great. He would say, we are not going to have the Noah's Ark model with two of everything. This model leaves your organization in a state of limbo for a longer period, and it's destabilizing, said Miss Williams-Carlson. It's important to move quickly and thoughtfully when making tough decisions. The so what on this is, we talked about this before. We talked about this because I heard John Starcher, the CEO, speak at the JP Morgan conference the last 2 years. And 2 years ago, he talked about the merger. And then this year, he gave an update on the merger. And it was interesting. When he talked about it the first time, he said, we made a bunch of decisions right out of the gate. We knew which EHR we were going to go on. We knew which ERP we were going to do. We knew which PAC system we were going to do. He goes, we made those decisions very rapidly. We also identified the top 30 leaders within the health system very rapidly, and we identified the next layer underneath that of leaders, and we identified them within the first 30 to 60 days. They removed a lot of the fear, uncertainty, and doubt associated with the merger. And then, what they did from an IT standpoint is they picked those right solutions and they started work almost immediately. Too many of these mergers come together and then they start the work of, what are we going to do? And then they spend the next 6 to 9 months or year or 2 years with committees trying to make decisions on what systems to do. The problem is that just breeds a bad culture. When you're making these decisions that quickly, you start working together on a shared and common goal of eliminating these applications, bringing these systems together. If you keep people working towards common set of objectives and goals, they're not going to have time to get all bogged down into, do I have a job, do I not have a job? They have a job. There's a lot of work to do. We're always saying this in mergers. There's a lot of work to do. They did this well. They did this right. It's a model. I hope we get more documentation out of this merger and how they did it because it is truly exciting. All right, last but not least, the story I will leave you with. ONC's Rucker calls out hospital leaders who signed Epic's opposition letter. Fierce Healthcare is where I'm pulling this from. Speaking at Health Datapalooza on Tuesday, Rucker, who's the head of ONC for Health IT, acknowledged that privacy in a digital world is a challenging issue, but he reiterated his perspective that patients should be able to easily access and share their medical data. It is our human right as patients to have access to our data, he said. Most of their customers did not sign that letter, Rucker said. If you parse out the big academic medical centers, only 3 out of 100 AMCs signed on. He also called out hospitals that signed the opposition letter due to the claims about data privacy concerns, but then disregard patient privacy when filing lawsuits for unpaid medical bills. One of the signers of the letter is known for taking thousands of patients to court. If you take someone to court, that information becomes public discovery. Their medical care is now public. It's part of the court record, he said. Looking at protecting privacy, we need to walk the walk here as we look at who is saying what and letter writing, who's saying what in the letter writing campaigns. I said this a couple weeks ago when people signed this letter. I said I would stay out of this. The reason I'd stay out of it is because big punches are going to be thrown in both directions. And you know what happens when you get in the middle of a big fight with prize fighters? You get hit. And and that's what is starting to play out. This is going to start to play out in the court of public opinion. I think we may see some some political candidates start talking about this type of issue. It's really interesting. He went on to say APIs are the technology used to link IT systems such as EHRs with apps and will bring healthcare into the modern app economy, according to Rucker. ONC's vision is for patients to choose what apps to use, he said. We often looked at interoperability in a narrow view. I love this. We often looked at interoperability in a narrow view, which is just as a replacement for moving the patient's chart. Modern computing and APIs offer a vastly richer and more empowering global computing environment. Well-built APIs can do almost anything that your creativity allows, he said. Here's my so what. He's not wrong. You may not like how he says it, but he's not wrong. APIs, and we've experienced this. We used to have green screens, and then the internet came out, and then we had visual internet and graphics, and we could click on images, and then we had APIs sort of come about, and then we had apps sort of come about. And I don't know about you, but I'd rather interact with. There's a whole host of things now I'd rather do on my phone than on the web page. And that's just the morphing of how data moves and how we interact with data and how data is used in our environment. And that's going to continue. The ONC is going to win this, by the way. The government is going to win this, go figure. And this is going to become the rule, the operating rule. We're going to have to figure out how to operate with this. And we should, quite frankly. This is the future. We say we're about technology and moving healthcare into the future, and we're about what's best for the patients. This is what's best for the patients. This is what the future is. That's all for this week. Special thanks to our sponsors, VMware, Starbridge Advisors, Galen Healthcare, Health Lyrics, and ProTalent Advisors for choosing to invest in developing the next generation of health leaders. This show is a production of This Week in Health IT. For more great content, you check out the website at thisweekhealth.com or the YouTube channel. If you want to support the show, the best way to do that is to share it with a peer. Send an email and let them know that you value the show and you're getting a lot out of it. That is greatly appreciated. We'll be back again on Friday with another interview, and on Tuesday we'll be back with another news story. Thanks for listening.